stimulant which excites neural activity and speeds up body functions. It is categorized as a Schedule II controlled substance by the federal government. Schedule II drugs have a high potential for abuse and may lead to severe psychological or physical dependence. Cocaine is also known as crack, coke, Big C, Charlie, nose candy, candy cane, snow, base, flake, and many other street names. 5% of adults between 18 to 25 use cocaine, and at least 30 million people have tried it at least once. Let's take a look at one of the 2 million people who are addicts.
For people, there are many different reasons for taking the drug: anxiety, depression, paranoia. However, there might also be biological influences at work. In 2009, the National Health Service in the United Kingdom reported that a gene was discovered that increased the risk of cocaine addiction. In this case, the patient was peer pressure. This patient snorted the drug, but it could also be dissolved in water and injected or smoked. The drug induces a sense of exhilaration in the user by blocking reuptake of dopamine in the midbrain. Cocaine allows humans to experience an intensity of pleasure, offering the most wonderful state of consciousness and an intense sense of being alive. There are some pleasurable effects where the user has a rush of euphoria, confidence, and energy, but it's better to hear it straight from the addict.
I was pressured by some friends to try cocaine because it was what everyone was doing. Instantly after taking the drug, I felt amazing, exhilarated, excited, and confident. But after a few hours, I had an immediate crash accompanied by a strong craving for more cocaine. I also felt tired with a sense of fatigue and anxiety. My body felt drained. The doctor also told me there were effects that occurred in my head. Because cocaine blocks the reuptake of dopamine molecules in the synaptic gap, dopamine remains stalled in the gap, stimulating the receptors and resulting in higher dopamine concentrations. Over time, that lowers the availability of dopamine D2 receptors in the brain region and leads to an addiction-promoting alterations in cognitive functioning and decision-making. Quitting was really tough. I went to a treatment center which specialized with my addiction, where they helped relieve my withdrawal symptoms with medical detoxification. There was psychological treatment with therapists, counseling sessions, and recovery and support programs. Other than psychological treatment, there are also antidepressants and other medicines that are effective to reducing certain symptoms and decreasing the crave for the drug. Take it from a previous addict. Drugs waste your life away. Oh, but they're so good. I need some more. No, get your hands off me. Get your hands off me.